Hare Krishna, Sadar Pranam, a very warm welcome to the day 27 of my YouTube channel, Dental Tips. Today's agenda, today's topic of discussion. Today we are going to discuss about deciduous maxillary first molar. So, this deciduous maxillary first molar, we are going to discuss about the crown portion, we are going to discuss about the root portion, we are going to discuss about the pulp and the pulp chamber. Coming to the crown portion, the crown is studied from 5 aspects, buccal aspect, lingual aspect, mesial aspect, distal aspect and occlusal aspect. So let's discuss these aspects one by one. Coming to the buccal aspect or buccal surface, as discussed in the previous videos, is that surface of the tooth which faces the cheeks. And now this buccal aspect has uniform convexity in all directions, except that there is slightly more convexity occluso-gingivally or occluso-cervically. Now there is a buccal groove present in the buccal aspect, and this buccal groove is distal to the center of the tooth. Now this buccal groove, it is slightly marked if ever present. Now we come to the lingual aspect. In the lingual aspect, the convexity occluso-gingivally or occluso-cervically is less as compared to that on the buccal aspect. Now, the lingual aspect, as we discussed in the previous videos, the lingual aspect of the tooth is that aspect of the tooth which faces the tongue. Now we come to the mesial aspect or the mesial surface. Mesial surface of the tooth, as discussed in the previous videos, is that surface of the tooth which is close to the midline of the face. Now the mesial aspect, it is broad. It's broad in the cervical region and it is less broad in the occlusal region. Now we come to the distal aspect. Now distal aspect, it is narrow as compared to the mesial aspect. And as discussed in the previous videos, distal aspect is that surface of the tooth which is away from the midline of the face. Now we come to the occlusal aspect. Now the occlusal aspect, occlusal surface of the tooth, it is a chewing surface of the tooth, and the occlusal surface is present in the posterior teeth, premolars and molars. And in deciduous teeth, as we have discussed in the previous videos, deciduous teeth, there are no premolars, there are only molars, first and second molars. So the occlusal aspect, it has 4 cusps, 3 or 4 cusps, there is this mesiobuccal cusp, there is this distobuccal cusp and mesiolingual cusp, and sometimes distolingual cusp. So this distolingual cusp is not always present in deciduous first molar. So now we come to the line angles. As discussed in the previous videos, line angles of a tooth are where the 2 surfaces of the tooth meet. So the line angles of this deciduous first molar, they are mesiobuccal and mesiolingual line angle. Now we come to the root portion. The root portion, as we discussed in the previous videos, root portion is that portion of the teeth which is present in the socket, alveolus. And now the roots. In this deciduous maxillary first molar, the roots are mesiobuccal, distobuccal and lingual root. Now we come to the pulp chamber and pulp canals. As discussed in the previous videos, that pulp chamber is always present in the coronal portion, crown portion, and pulp canals are present in the root portion. So as there are 3 roots in this maxillary deciduous first molar, mesiobuccal, distobuccal and lingual. So the number of pulp canals will also be 3, approximating corresponding to the number of the roots present. Now we come to the pulp chamber. As we discussed in the previous videos, pulp chamber always approximates with the outer contour of the tooth. Now the pulp chamber has pulp horns. Now in this particular case, that is deciduous maxillary first molar, the pulp horns, they are more pointed as compared to the cusps. Now with this I end my today's session. Thank you many folds for watching my YouTube channel Dental Tips. Jai Shri Krishna.